They were born at 37 weeks, which is pretty far along for twins, but he needed some help with breathing, so he was on CPAP for a few days and then on some oxygen as well until he was able to breathe on his own and keep his temperatures up on his own. This is Lawson. He was the one who was in the NICU. And then this is his twin sister Luella, who was not considered NICU status but was able to stay with the family in the NICU as well. Our OB had recommended that we tour the NICU ahead of time, so we did do that, and we were really impressed already with just the staff and everything that they had explained to us. So we were really comfortable that if they needed NICU level care that we were delivering at Bellin.
And a lot of things that they planned for that you would never think about. They definitely went over every single possibility they could to take care of families and little patients.
Right, and they had rooms specific for twin families with like a split door in between, so that we actually had like 2 rooms that were attached.
With Lawson having his own separate room, we had that huge room, pretty much just us 3, and it made it not so cluttered and stressful.
I can't imagine what it would have been like to have to leave the hospital without him and not be able to stay, or even to have her in the regular nursery and him in the NICU and not be able to keep them together. We were able to be the ones there every day working with him, learning how to take care of him, do his feedings, things like that. The staff were really great too at teaching us everything we needed to know for caring for both of them.
I think that was a huge part, as we got almost a 7-day trial of how to do things before we came home. When he was getting better, they would ask us, do you want to feed him? Do you want to change his diaper? Do you want to rock him to sleep? And then if we were overwhelmed, they would do it for us and kind of give us a break rather than us going home and not having a break. So that was pretty huge.
The communication is excellent between the providers and the nursing staff and all the ancillary staff.
With all the help they have, with being there, with knowing every single step, you're not waiting for answers of how they're doing, you're watching the progress. And I think that encouragement of watching them get better is just, it kind of really brings that anxiety and stress level down. Couldn't think about how you could go through that without having it the way the Bellin has it set up.
We are so thankful that Bellin opened a NICU and that they are doing things so differently than most traditional NICUs, and that it worked very well for our family. We're really appreciative of them.